Welcome to the media briefing today. The speakers today are Dr. Albert Au, Principal Medical and Health Officer of the CHP, and Dr. Larry Lee, Chief Manager of the Hospital Authority. Now, would Dr. Au please tell us about the new cases? Good afternoon, members of the public and media friends. I now report to you the new cases recorded on the 15th of June, yesterday. Yesterday, for locally infected cases, the total number was 1,085, including 423 PCR positive cases and 662 RAT positive cases reported to our system and then reconfirmed by PCR test. And also, yesterday there were 94 imported cases. Among the 94 imported cases, 38 were caught as the temporary specimen collection center at the airport. 43 were caught during hotel quarantine. The remaining 13 were tested positive after completion of hotel quarantine. Genome sequencing will be performed for these cases. For deaths, we have no new deaths yesterday. So far, in the fifth wave, the total death number stood at 9,179 cases. For residential care homes, there were no new cases reported by care homes, either residents or staff, caring staff. Yesterday, there was a reported outbreak at a residential care home for persons with disabilities. That is the Christian Family Service Center, Shangshun House, as the Kai Nung Integrated Rehabilitation Services Complex at Kwun Tong. All healthy residents have been sent to the AWE for quarantine. Two residents are tested positive, and one caring staff who was responsible for accompanying some cases to AWE was also tested positive. The other 13 caring staff are so far negative. For schools, since yesterday afternoon, we have received 113 cases reported by schools, including 83 students, 30 teaching staff, involving 103 schools. Among the 103 schools, 38 have reported more than 2 cases in the past 7 days. Today, we don't have any new outbreak in classes. The kindergarten, that is a Fu Wing Garden kindergarten, which has reported cases before. They have 3 cases today. So a K1MA class has been ordered to suspend. Previously, PN Blue and PN Yellow were also ordered to suspend because of outbreaks. Now we have 19 new suspected BA.2.12.1 cases, including family members. 1 is an imported cases. The remaining 18 are locally infected. Among them, 7 are untraceable. 8 are the close contacts of those 7 cases or family members. They live at Sham Shui Po, Taipo Road 128. That is Yat Hua Hin, Fortress Hill 160, and Chui Ging Mansion at Fa Hui Road with 4 infections. Ching Shui, Clearwater Bay, a family, and also at a Fu Wing Garden in Tuen Mun, 1 family with 2 infections. Choi Tak Estate, Choi Yin House in Kwun Tong, and Tong Sang Chun in Lam Chun with 2 families, and 3 cases are with epidemiological links with previous cases. 1 is a family member of a worker from the Nam Wan tunnel, and also a colleague of a resident at a Kwun Long House. Another one is the close contact of a patient from the track and field team of Puijing Middle School. And we had 4 suspected BA.5 or 0.4 and 0.5 cases, all imported. Now from Rest City, we have one more case. So far, there are 24 cases. For FLM, we have one more patron infected. So far, there are 34 cases, including 31 patrons and 3 staff members. Some updates about our new triage system. The Secretary for Food and Health on the 14th of June has announced that to prevent the outbreak involving a new variant, if family members need to share bedroom or toilets with confirmed patients, they will be sent to isolation facilities to safeguard their health. Under the enhanced measures, for any cases who need to share bathroom or room with family members to avoid risk, they will be sent to undergo isolation at Penny's Bay. To enhance the measure, the CHP has updated our online survey questions to assist us to assess whether a patient is suitable to undergo home quarantine or home isolation. Now, concerning the toilet, the question is whether there is a independent toilet for the confirmed patient. If the answer is no, then the patient will be sent to isolation center for isolation. Concerning the address, the CHP will enhance assessments and confirmation of the environment. If there are deliberate false declaration, we do not rule out any enforcement action. Thank you. Now, Dr. Lee, HA situation, please. Good afternoon. Under HA, there are 422 confirmed patients in hospitals. 65 are new patients. Among patients in isolation facilities, 117 are in isolation wards, 13 in second-tier ward, 64 are in the North Lantau Infection Control Center. 38 among them are new patients. We reported 1 more patient in critical condition yesterday, 4 serious. For the critical patients, they don't have vaccination record. For the 4 serious patients, 1 has no vaccination record, 2 had 2 doses, 1 had 3 doses. Among the inpatients, there are 17 critical and 9 serious patients. Among the 3 critical patients are in ICU. In the day past, no COVID patients has passed away. Yesterday, 53 patients have recovered, including 46 discharged. Since the 5th wave, we have 51,616 patients recovered, including 56,700 patients recovered. Since early 2020, we have 63,445 patients recovered, including 63,056 patients discharged. 1 patient was confirmed on admission to hospital. 2 patients in the same ward are classified as close contacts. For staff, 23,782 staff members have been infected, and 23,687 of them have returned to their job. Now, please raise your hand for your questions and identify your media organization, please. The gentleman over there. Good afternoon, doctors. I'm from Mingpao Daily. Following up on the Pui Jing Middle School situation. So far, how many cases have occurred? Now, on that night at Gourmet Hotspot, were there other customers, or were all of the customers students? And how many people were there? And what is the risk of an outbreak? Now, for residential care homes, recently we have seen different care homes, including the Shun Chun House in Kwun Tong, having outbreaks. Now, how would you assess the outbreak scale and how big the cluster will become? On the 15th of June, there was 1 patient who was not vaccinated. And why was that? Because previously, it was said that the vaccination rate has been boosted a lot. Now, for BA.2.1, 2.1 strain, the Homentine construction site at Shong Guang Street, how many workers are there and how many cases are from there? And how many BA.2.1, 2.1 cases are there in Hong Kong? Is the speed of increase as you have expected, and we will replace the prevailing strain.
Thank you for your questions. First, about Puching Middle School. At present, the number of cases is still 6. For these 6 cases, they are all members of the Puching Middle School athletic team. Well, on the 17th of June in the evening, they had a meal gathering and they chartered the restaurant. Over 60 people attended the dinner, including teachers and students. So they had a dinner gathering there. Well, for other students, they have taken RAT today. We do not see any new case. For these 6 cases, well, they are epidemiologically connected. They are all members of the athletic team. Other than the gathering that evening, they had also been receiving trainings together. So when they were receiving trainings, they took off their masks. So we cannot be sure whether they infected each other when they were training or they came into contact with each other during the dinner. So we are still closely monitoring the situation. For these 6 students, they attended different classes. We have also tested their classmates and the results are negative. We haven't seen any new case yet. We are still monitoring it very closely. And well, for those who have tested out T positive, they didn't go to school afterwards, so we don't think it's that infectious. And the school would do RAT for all the teachers and students every day, so we will be monitoring the situation. As for the risk of outbreaks at care homes, yes, now in the community, we can see a significant increase in the number of cases. So in the community, there are chains of transmission. Care home staff live in the community. They may have the risk of being infected. So if staff are infected when they go to work, that's a possibility that they would infect the residents. So for our assessment, we think the risk of having outbreaks and care homes is increasing. So we urge the staff and residents of care homes to take RAT every day. And when there are new cases, we hope that we can discover them as soon as possible. We also hope that preventive measures can be taken. For example, we would send the infected residents to isolation facilities, and their close contacts will also be sent to quarantine facilities. And also, we hope the inoculation rate of care home residents can be increased. Now, if the inoculation rate is high, when there's an outbreak, the possibility of severe cases and death will be significantly reduced. As for the home and construction sites, the number of cases so far, we have no new case. For these 4 cases, they use the same container as brick rooms, and 3 workers are under quarantine right now. There's no new case. As for BA.2.12.1, the total number of cases in Hong Kong up to now is 204. So it only accounts for a very small amount of the total number of cases. But for this sublineage of Omicron, there is indeed quite a wide spread in the community. Most of the cases are untraceable. We do not know where the sources are, and there are silent transmissions in the community. So for these untraceable cases, they are not concentrated in a certain district. In many areas, you can find such cases. So we believe the virus is being spread in the community. This reflects the whole situation of Omicron transmission in Hong Kong. Other than BA.2.12.1 in the 5th wave, we have also seen BA.2.2, and we have also seen an increase lately. Other questions, please? I'm from Orange Media. Well, for Puching Middle School, the students went to the restaurant to make hot pot. Does the restaurant have to be suspended for inspection? And how about the ventilation system of the restaurants? And for Shangzhen House, well, that's not one new case today, and that person is responsible for transporting residents. Was that staff member infected by residents? And there are now clusters at care homes. So do you think the 24-hour RAT records should be expanded to care homes at Canaan Kindergarten? There are new cases. So these new cases from the same floor of the previous cases. So these new cases, have they come into contact with the old cases? Well, for Gourmet Hot Pot, we have tried to find out what happened. The teachers and students chartered the restaurant for that evening. And also, during the trainings of the athletic team, the students might have infected each other. Or during the dinner, the people also took off their masks. They also might be able to infect each other. We have identified all the teachers and students from the dinner. We suggest them to take tests, and now we have found 6 cases. Well, for these restaurants, we have suggested to them that all the staff should take PCRs. So far, no positive results have been found. We also suggest the restaurants to undertake a thorough disinfection. It does not have to suspend its business. For care homes, for the Shangzhen House staff, he had a PCR negative result before, but then he showed symptoms. So he took another PCR test, and then this time around the result is positive. He has taken care of infected residents. He helped to assist to transport a resident to an isolation facility. He put on his PPE, and also he had donned his mask, but it was quite a close contact, so he was also at risk of being infected because the Omicron sublineage or the Omicron strain is quite infectious. So before the staff go to work every day, they have to take an RAT. And some of them would regularly do PCR. Well, for these people who work at high-risk care homes, every day they have to do RAT. So if there is any case, we would find it out very quickly, and this would prevent the spread of the disease at the care homes. RAT is not 100% reliable, so we have talked to care homes. Now, if there's any onset of symptoms for anyone in the care homes, we hope that they can take PCR as soon as possible. As for Canaan Kindergarten and that new class, the students didn't have common activities with students from other classes. They didn't use the same facilities. Well, one teacher that was teaching another class was infected. She also taught this class, so maybe that's the connection. For the other classes in the kindergarten, we've also found some sporadic cases. I'm from AM 730. I want to ask about Canaan Kindergarten. Now, for the new class, you mentioned today, well, how many students are in that class? And one class was suspended earlier, so how many students were in that class? You also talk about sporadic cases, so how many cases in total?
Concerning the FEHD's new direction, RAT should not be conducted on site. However, Legislative Council members suggested we learn from, we make reference to Singapore's method, that is do RAT on site. So what do you think? And also for those customers who haven't done a RAT yet, RAT kit should be provided for these customers. So what do you think an impact it will have on the business of the bars? Now concerning the imported case, have you confirmed that it was a case from the quarantine hotel? Now for the Canon kindergarten, there were two classes, that is PN Blue with 3 cases and PN Yellow with 2 cases. The new class today is K1MA with 29 students. 3 cases have occurred. It has passed the 10% threshold. Quite a number of children have been infected in the class. After risk assessment, we have advised the class to suspend classes. The previous 2 classes also had an infection rate surpassing 10%. In other classes, there are sporadic cases, around 1 in each. There are no clusters, so we will continue to monitor the situation. We have advised the school to step up disinfection. So far, we have seen no inter-class transmission or a major outbreak. For the classes involved, we have advised a 7-day suspension of school. The other students are also subject to the daily RAT requirement. On your question about patrons of bars and nightclubs, a 24-hour RAT result has to be presented. We advise people who go to these high-risk places to do a RAT at a private place, for example, their homes. If the result is positive, they shouldn't leave the home. And we do not advise doing a test at the bar. If the result is positive, it may cause infection at the bar. Yesterday, the FEHD has issued a press release and uploaded some FAQs on their website. So please refer to the latest guidelines from the FEHD. For the outbreak at Sky City, the Public Services Laboratory has performed genome sequencing for all 3 cases. The first 2 cases, that is a crew member and a cleaner, the results are the same, that is BA.5. For the 3rd case, the result is pending. However, the 3rd case is a close contact of the 2nd case. So we believe the result is likely identical. So for the 3 cases, it is likely that the first patient passed the virus to the 2nd and the 3rd patients during work. For the source of infection of the first patient, we have performed genome sequencing for all patients which surfaced during the same period as the first case. However, we haven't found any identical cases. So those cases are not the source of infection of the first patient. There are other cases which were tested positive on RAT during the same period. However, there are no PCR samples available for genome sequencing. So we suspect that it is one of the patients who has infected the first patient, and then the first patient passed the virus to the other 2 colleagues. So we have performed a new 2 extra rounds of PCR tests for the residents at the quarantine hotel, and no new cases were found. Hi, Hong Kong 01. Now concerning the trend, today's new local infection number has surpassed 1,000. So we will rise any further. And is there any need to tighten the social distancing measures any further? Now concerning the updated RAT requirements for pubs, it was mentioned yesterday that some bars, the bars which have a restaurant license should also require RAT negative results for entrance. Now, what about bars which only possess a liquor license. So if a restaurant is selling for restaurants which also sell liquor, does the pub requirements apply on them? Now, concerning patients sharing a same bedroom with other family members, they need to be sent to quarantine to Penny's Bay. So after the new measure has come into place, how many people have been sent to Penny's Bay? Now, you said for deliberate false reports that there will be enforcement action. What kind of enforcement are you talking about, and how will you be able to find out that they are lying? Would you have to visit the house? Thank you. Please let the doctor reply. Thank you for your questions. First, about the trend of the epidemic. We are aware that in the past 2 weeks, the number of local infections has risen steadily. Today, we have surpassed 1,000. We expect the trend to continue for some time. The main reason is that we are returning to normalcy, and social distancing measures are being relaxed gradually. When we have returned to a normal life, we would go out and we would go to restaurants. When cases and transmission chains still exist in the community, we expect to have more cases. We will pay close attention to the situation, and we certainly do not want to see an exponential growth. Indeed, there is a growing trend. However, the number is still much lower than the peak in the fifth wave. We will closely monitor the other indicators indicating the pressure of our public healthcare system, including the hospitalization rate, serious cases, deaths, and ICU occupancy rate. These indicators are still at a stable level. With the growing number of cases, the indicators may rise. Yes, we are returning to normalcy, but please bear in mind we should wear masks and conduct a RAT test to find out your infection status and pay attention to your personal hygiene. For bars, it is a requirement under CAP 599F. So you may have to consult the relevant departments, including the FEHD, to learn about the RAT requirements for entering restaurants with a liquor license. I don't have any further information on that. For isolation policy, we are adopting a risk assessment approach to assess whether a patient is suitable to undergo isolation at home. If there is an independent room and an independent toilet and the patient is not of high risk, and he is able to seek medical help if the situation turns bad, and if the ventilation is good, then he would be suitable to undergo a home isolation. We have a questionnaire for assessment purpose. We want to step up the accuracy of our assessment. If a patient needs to share a bathroom with other family members, it would increase the infection risk of other family members. So for these cases, to safeguard the health of the family members and lower the risk of infection, we want to send these patients to isolation facilities for management. The information would be collected via our online questionnaire and also a phone conversation. We would pay attention to the address submitted by the patient. So if we understand that there is only one toilet for most of the household in the building, then we would do more investigation. And also contractors would be sent to collect a sample for PCR test. If it is found that they only have one toilet at home, they would be sent to quarantine center. So we hope the public can give us a truthful report. If there are any suspicion, we would follow up.
The lady in blue, please. Please tell us about your medium. I'm from Now TV. Just now you said that you would take note of the address they report to you. So if they are living in a public housing estate, you would be sure that there's only one toilet. So you would look at the types of the residential blocks that they are living in. Now, for the online Q&A or questionnaire, we hope that the patients can fill in the information and give us the real and true information. And one of the questions, as you may know, is about toilet. Well, we would ask the patient, does he have an independent, exclusive washroom at home? If not, after using the toilet, does he think that the toilet can be completely cleaned afterwards? Now, some patients in the past, they told us that they only had one toilet at home, and they were sure that they could clean it and disinfect it after each use. But now we have changed the questionnaire. If the patient only has one toilet at home, then we would know that's one toilet. And if that he has to share that toilet with his family members, we think the risk is higher. So we would arrange for the patient to go to an isolation facility. We hope that we can get the true information from the patients. We hope to understand their living environments better. And if we find that the home environment is not appropriate, then we would send them to a quarantine facility. I'm from cable TV. I would like to ask Dr. Au, just now you mentioned the 7 cases of BA.2.12.1. These are cases with unknown sources. So where have these people been to? And have you issued guidelines to stop your colleagues from having meal gatherings? Can they have meal gatherings after work? If not, do you think you're infringing their human rights? And if you discover that the colleagues are having meal gatherings, what would the Human Resources Department do to them? Thank you for your questions. First is about the 7 untraceable cases concerning BA.2.12.1. Now, we will follow up on these cases. We will try to find out where they have been to in the past 7 days. Now, for most of the cases, there's nothing special. They might have gone shopping, they might have gone to restaurants, or they went to work, or most of them would stay at home. So there was no special activity. Well, maybe they had also had some gatherings, they met with friends, etc. And for the close contacts, we didn't find any infected cases, and we do not find any epidemiological connections with other cases. So we do not know the source of their infection. Other than these 7 cases, up to now we have found 62 cases that are not traceable. That is, the sources are unknown. So for these 62 cases, the family members or residents living in the same block, we found 87 cases that were related to them. Well, maybe there was a vertical transmission in the residential blocks that they lived in, but for many cases we couldn't find the source. So we would arrange for such cases to be sent to community isolation facilities, and their close contacts will also be sent to quarantine centers. We hope to cut off the transmission chains in the community as soon as possible. As for the X-ray questions, I would ask Dr. Lee to answer them. Well, for our colleagues, well, internally, we have posted messages on our journals and circulars. That is, even if they have meal gatherings, we hope that they can keep a social distance, because we fear that there may be mass infections that will affect the operation of hospitals. Lately, we have discovered 2 incidents. Our colleagues had meal gatherings, and some of them were infected, and eventually there was pressure on manpower. So, of course, we will do some internal deployment to fix the problem. Now, we will monitor the situation closely. If there's any breach of rules, we will handle the relevant people very seriously. So we urge our colleagues to be very careful about meal gatherings, and even they have meal gatherings, they should wear their masks when they are not eating. And from TVB, I would like to follow up on Rex City and FLM. Have you tracked down all the customers, and have you issued CTN to all of them? And lately, you say that there have been 2 cases lately that are related to meal gatherings at hospitals. Now, for the United Christian Hospital, the meal gathering involved quite a number of people. So would there be any penalties for those colleagues that attended the gatherings? As for the 2 bar clusters, through the vaccine pass, we have identified all the staff and customers. As for the staff of the 2 bars, they have all been tested. There is no new case. As for customers that have patronized these 2 bars, a small number of them still haven't tested. So we will issue CTN to them. So for these 2 clusters, I think each cluster, well, for Rex City, they had over 80 customers that night. For FLM, they have 120 and 22 customers that night. Most of the customers have been tested. That's no new case. So for these 2 bar outbreaks, we think we are seeing the end of it now. Well, for the 2 incidents, one was at United Christian Hospital. 6 nurses and supporting staff were infected. Up to now, the number is still 6. And previously, we have also seen other cases that I do not have any updates on them. We understand that, well, colleagues need to have their own social lives, but our duty is to take care of patients. And society has a high expectation of us. So I hope colleagues will understand that, and I hope they can try their best to avoid meal gatherings. Well, that's the end of today's press briefing. Thank you.